Yeah, it's a little bit different setting, but if you do have questions, on the COVID issues, that's fine, and I certainly will spend a few minutes if there's non-COVID issues.
Governor, we're going to start with Brian.
Actually, Mr. Lunny, how has COVID impacted the sports season so far, just a few weeks in? Have you had to cancel games, reschedule games? Has it been an issue and an ongoing problem, or is it not as bad as it was before?
Yeah, similar to last year, there have been some interruptions with games, but for the most part, we have had a lot of teams that have vaccinated. The difference this year is that kids are vaccinated, so whole teams are not as being quarantined as much.
What is kind of the protocol, depending if you're vaccinated or unvaccinated?
Well, there's a lot of it's really kind of more complicated this year in a lot of ways. But the most important thing is if you're vaccinated and you're not symptomatic, you will not have to quarantine.
Superintendent, I don't know if you want to answer the same question. What are you seeing in terms of how school has been affected in terms of are you having to quarantine groups of students or classes or what's that like?
We've had low numbers in most of our schools with the exception of one. Generally, the numbers have been running about 4 to 6 in each of our schools. We had a high number at our Winter Hill School. That was a 13. And we're doing close contact, so we're using that 6-foot radius. We're considering whether students have masks on or not masks on, what the setting is. So obviously a lunch period is much more dangerous than in a classroom. But for the most part, we are trying to keep all of our students in school and only quarantining when necessary.
Next question over here.
Probably best for Dr. Alexander Scott on this. There has been some attention paid to the mandate that healthcare workers must be vaccinated. And while we certainly understand that issue from a public health perspective, some healthcare workers have raised the issue of possibly qualifying for a vaccination exemption on the basis of prior infection and recovery. And is there some way to do that? Do you have a position on that? And is it possible to test that based on something like antibodies in the blood?
Thank you. The medical exemptions that are allowable with our vaccination requirement are very specific ones that have been issued by the Centers for Disease Control and Prevention. They're consistent with what we use for all of the vaccines that are critical and important. Having prior infection is not one of the medical exemptions, and it's an important message to be able to say, even if you have been infected in the past, particularly given how quickly and significantly the Delta strain arrived and became predominant, we are recommending anyone who has already been infected previously to still get vaccinated again. That is the primary protection mechanism, particularly against the Delta strain and also against any future iterations of coronavirus that are necessary. So whether or not you've been infected before, getting vaccinated is your strongest protection.
And to follow up on that, Doctor, it's been reported that although all the colleges have required vaccination of students, not all have required, I believe, vaccination of faculty and staff, although that may have changed. And secondly, it's been reported that, at least at the University of Rhode Island, religious exemptions have been unusually popular, apparently because they simply have a box to check on the web form rather than submit any kind of substantive documentation. So has the state thought about trying to reassess whether the criteria for religious exemption need to be tightened or changed? And well, I'll leave the question there.
Yeah, many colleges and universities who really are the model out there in being the first employers to move in the direction of requiring vaccines while continuing their strong testing program, ventilation, and indoor masking, which are those 4 key components we've been telling businesses and employers that's the way to really ensure safety and confidence for your employees and consumers. Many of the colleges and universities have also moved in the direction of requiring vaccination for their staff and faculty. We absolutely applaud the ones who have done that, and really applaud the staff and faculty whose numbers are high as well in terms of vaccination coverage. The religious exemption also has very specific federal requirements that allow for the level of tightening that's in place. It definitely needs to be a strongly held religious belief. There are certain religions that actually fulfill that. Our goal is to be here to support employers in being able to implement the strongest vaccination policies possible to help make sure as many Rhode Islanders are safe as we can.
Thank you.
Dr. Scott, you could just stay there for 2 questions, please. On Sunday, the Rhode Island Department of Health tweeted, among other things, that Rhode Island COVID-19 hospitalizations continue to increase as they ask Rhode Islanders to get vaccination. According to HHS.gov Data Hub, Rhode Island hospital capacity taken up by COVID patients was 4.9%, down from 6.22% the previous week. ICU capacity continues to slip, taken up by COVID, dropping from 18+% to under 12% in the same time. Dr. Scott, there exists a significant trust gap with the state of Rhode Island and its citizens for a number of reasons. Generationally, was this an intentional mistake, or was this an accidental misrepresentation?
I don't see any mistakes. I feel like our Rhode Islanders understand the importance of vaccination, and there are high vaccination rates across the board. You're welcome to ask your second question and further clarify what your first one was.
Well, you've got 2 different numbers. I'm not sure how clear I have to be. There's one number that one website is reporting from the federal government, the other number that Rhode Island's reporting. They're different. And there's a misrepresentation there, maybe unintentional. So I'll just leave that hang. But just as importantly, last week the Coalition Radio attempted to reach the Department of Health and asked them about a practice this week, which meant where this is incredibly enough at the ACI, Bring Your Family to Work Day. And one of the traditions in that was to bring people through the prison, which of course, if you're paying attention to the science, the CDC clearly suggests strongly that no one be interrupting prison communities with those type of tours. We weren't answered again, and we're wondering what the status on that was.
So to respond to the first point, we have a Class Act A+ amazing data team here in Rhode Island that's been throughout the pandemic. We also know that our data, as well as what our federal partners produce, evolves, and we work closely to reconcile when there are any gaps that could be connected to them receiving the information on the update. We can continue to do that. We have throughout the response. Your second question is an important one. You know, we want to ensure that all practices throughout the state are responsive to what's needed to keep people safe and protected from coronavirus. We also, as a department and a state that honors equity and human rights, want to always ensure that everyone is treated like the human beings that they are, regardless of where they reside or why they are there. So that's something we'll continue to support and promote, and we'll look forward to helping to see all practices follow in that vein.
Respectfully, Dr. Scott, you didn't answer the question. Could you please answer the question? Is it happening this week or not? And after being inquiries both from the American Civil Liberties Union as well as small reporting groups like ours, you can't claim that you're not aware of it. So please answer the question. Is it happening or not? We understand you respect the process. Is it happening?
So your question is directed to the Department of Corrections that actually hosts that event. It will be important for them to answer that. And I am aware of it and will continue to work with them on handling that as safely and appropriately as possible. Thank you.
The next question, Pat. Wayne?
You have no oversight over the Department of Corrections?
So, good afternoon. There seems to be some confusion as to whether children under the age of 12 can leave the state and return, and do they have to quarantine for 7 days on their return? So the question is, do children who leave the state and then return under the age of 12 have to quarantine for 7 days when they get back to Rhode Island?
Right, so they certainly can leave. We would support following the guidance that's in place for any unvaccinated community in terms of travel, any unvaccinated population. It's also another reason to go ahead and get vaccinated. Our current travel guidelines do involve a form of quarantining and testing upon return from areas that are hotspots based on our current definition. So we would encourage, one, anyone around a child who is currently ineligible to get vaccinated to be vaccinated to ensure their protection, and two, to follow what our current guidelines are for travel and return from an area that is a hotspot if you are unvaccinated.
Hi. This is for Governor McKee. On Saturday, it's my understanding that the executive order that requires masking in schools is going to expire. Do you plan to renew that?
Yes.
Question is either for Governor McKee or Dr. Alexander Scott. So you guys have mentioned that Rhode Island continues to be a leader in testing, but you know, with back to school and lots of kids needing to get tested, especially those who are unvaccinated, we've heard from parents in several different districts that the testing backlog has been pretty terrible, and that they've been waiting for days, and it's keeping their kids out of school for days, especially if they're not vaccinated. So I guess my question is, how does the state plan to address the larger volume in testing? And is there any plan under consideration for re-implementing distance learning for those kids that are missing out on school?
So testing is a critical piece for us. We learned some important lessons last year, and we really have a strong, comprehensive testing program that is available. One of the things that happened is the rapid rise of cases. We've had the capacity the entire time to expand as we need to, and that's occurring. Our current testing turnaround is 24 to 48 hours. Our goal has been throughout this pandemic response to get it around that 24-hour mark to the best of our ability. We're confident that we'll continue to respond appropriately to what we are seeing at this very early start in the school year, and make it so that our testing program, along with the updated guidance that's in place that decreases the extent of the quarantine process for those who are vaccinated, are the types of steps that are in place to help minimize disruption in schools. We understand the value of in-person learning and are doing everything we can operationally to ensure that our systems support that.
You have kids, though, that are missing school for potentially a week, and it's just the start of the school, so they're missing out on these things. And some students have said, well, we don't have Google Classroom set up, or we don't have this in place, so these kids are just outright missing school, and some of them may be going to the school for the very first time. So I guess has there been any talk of re-implementing distance learning plans, at least for those situations, maybe not a hybrid situation for the entire classroom, but at least to some extent for these kids that are calling out sick?
Our primary goal operationally from the department's perspective is to ensure that the few numbers of students that have had those extended times continue to get smaller and smaller in terms of that impact. We have the ability to make it so that it's 24 to 48 hours. It's not expected to be long-term, that there's a week. That's not been in place for months. So as school gets started, we're a week or two in, we expect that to smooth out and to make it so that there's as much disruption as possible operationally. In terms of ways to continue to support students and families, that's something that the Department of Education is all over, as well as the governor.
All right, thank you. We have a couple more questions.
So this question may be best directed to Director McCarthy, but maybe Dr. Alexander Scott would want to take it. Have you been in communication with the federal government in terms of what the approval process may look like and time frame for vaccinating people under 12? And, you know, I've read numerous reports that, you know, optimistically maybe end of October or something like that. And I realize that you simply may not have better information than I do, but do you?
No, so that's something obviously we've been watching closely, and we're excited for when those under 12 will be eligible. So what we've been guaranteed is before the end of the year. We have also seen the same reports that potentially as soon as October. I know President Biden committed to ensuring any resources necessary to complete the review would be available. So we're hopeful sooner rather than later. And if they were approved tomorrow, we would be prepared to run those school clinics and begin administering vaccine.
Do you have plans specifically for under 12?
We do. I mean, something that's been tremendously successful, and we've seen it just in the last couple of months here, our partnerships with our schools and our cities and towns, those school-based vaccination clinics where people feel comfortable, the vaccines administered by people they know. That has been the gold standard here in Rhode Island, so something we'll look to duplicate as well.
This is either for the governor or for Dr. Scott. You know, given the reason why we're here today about trying to get the message out about vaccinations for student athletes, do you plan on collecting the data in terms of high school student athletes who are vaccinated, and do you need to see a certain threshold in order to make a decision about kids wrestling, basketball, hockey that don't have to compete with masks this winter?
We are absolutely looking at the data continually. It's an excellent question. We want to continue to work with our interscholastic league partners as well as with the federal guidance as it continues to get updated to make determinations about mask wearing and otherwise. We know right now, as contagious as the Delta variant is, that prolonged contact over a period of time does benefit from not only vaccinated protection, but also mask wearing and any other of the mitigation steps that we've discussed. But it's something we assess continually, and as soon as we have ability to advance that further, we will. But we appreciate the students and athletes who have been doing it and making it work and have been the model on how to stay athletic, stay energetic, and also stay protected.